You've heard of butterfly children, those with epidermolysis bullosa, whose skin is as fragile as a butterfly's wings. But this fragility creates a silent crisis for their caregivers, who often become hidden patients themselves. Their lives are consumed by painstaking, hours-long daily wound care routines that never, ever stop. And every single moment is shadowed by the need to manage their loved one's constant, significant pain. This video breaks down the full reality of EB, the true cost for families, and the scientific breakthroughs offering genuine hope. So, what is EB? It's not an allergy. It is a group of rare genetic conditions affecting about 1 in every 5,000 children. A genetic defect means the skin lacks the protein anchors that hold its layers together. The slightest friction causes painful blistering. But EB isn't just a skin condition, it's systemic. The same fragility affects internal linings, like the esophagus, making eating excruciating. Over time, severe complications arise. Chronic scarring can lead to contractures, where fingers and toes actually fuse together. The body is constantly trying to heal, demanding immense nutritional energy. But because eating hurts, malnutrition is a constant battle. And this continuous cycle of wounding and healing significantly increases the risk of developing an aggressive form of skin cancer. With a condition this fragile and complicated, how do families even begin to manage daily life? You'll find out in a moment. The fundamental principle of care is preventing trauma. This means avoiding all rubbing or friction on the skin. It dictates everything. This is why medical professionals are trained to lift and place the individual, because sliding or rubbing would shear the skin. Because EB affects the whole body, management requires a whole team: dermatologists, dentists, hand surgeons, and pain specialists. But the challenges extend far beyond the hospital walls and into the healthcare system itself. Because the condition is so rare, many families find themselves in the frustrating position of having to educate their own doctors and nurses. A family's day is structured around dressing changes. This is a multi-hour process of draining blisters, cleansing, and wrapping limbs. This specialized care comes at a huge cost. The bandages and supplies alone create a substantial financial burden, often outside insurance. So, how do families manage? With intense dedication, exhausting routines, and significant financial and emotional sacrifice. Even bathing is a medical procedure. Families use specific techniques, like soaking in tepid salt baths, to reduce pain and prevent infection. All this effort is to manage the condition. But what about the pain? And does it ever actually get better? This is the question every parent asks. Does epidermolysis bullosa get better with age? The answer might surprise you. It's complicated. Some milder forms can indeed improve as skin thickens, but severe forms can worsen, leading to a shortened lifespan. Because pain is constant, managing it requires new strategies. Doctors now use topical morphine gels applied directly to wounds. They also manage the anxiety of pain by giving calming medications before painful procedures like dressing changes. And simple distraction, using music, games, or virtual reality, can be a powerful tool to help a child cope with the process. Recall the hidden patients from the start. This constant, intricate management of pain and finances is what creates that hidden burden. Combine the endless hours of care with emotional distress and social isolation, and the impact is profound. One study called it a bitter family life. So, does it get better? For many severe cases, the answer has historically been no. This is precisely why new breakthroughs are life-changing. But in the face of these immense challenges, science is finally providing new answers and real, tangible hope. In just the last few years, the situation has changed. The first ever topical gene therapies and healing gels for EB have been developed. What this means for patients is that wounds can finally close. It means less pain during dressing changes and a better quality of life. Supporting these families requires 3 things: expert medical support, practical aid for daily burdens, and emotional support for the caregivers. You can be part of that support. Share this video to raise awareness. Back organizations funding research. Offer understanding to these families.